Hi, my name is Misty, and for my persuasive speech today, I picked why we should not choose abortion. So what is abortion? Abortion is a procedure to end a pregnancy, and it can be done two ways: an in-clinical abortion, which is called surgical, or an abortion pill, which is a medical abortion. And the surgical also has two different kinds of that. There's a vacuum or a dilation and evacuation procedure, and they're both done in a clinic. And then 3 out of 10 women have had abortions by the age of 45, which is really high for abortion rates. So the processes of abortion are your surgical and your medical. So for your vacuum suction, it can happen up to your 15 weeks of pregnancy, and it's where a tube is inserted through the womb and the infant or baby is suctioned out. And dilation and evacuation can happen from 15 weeks and on to the end of your pregnancy, and it's the process of inserting forceps and the baby taken out that way. And the medical abortion can be done during any stage of your pregnancy in any trimester. And you take 2 different medications within 4 days, and it can lead to going in and having the doctors remove the baby, or it can come out on its own. And during that time, you're able to return home into your daily activities and just return to your normal routine until you have to go back in. And these are instruments used for abortion. These are your forceps, and that's the suction. And then those are the 2 different types of medication you use when doing the medical abortion.
Guided by ultrasound, the abortionist grabs the baby's leg with forceps. The baby's leg is pulled out into the birth canal. The abortionist delivers the baby's entire body, except for the head. The abortionist jams scissors into the baby's skull. The scissors are then opened to enlarge the hole. The scissors are removed and a suction catheter is inserted. The child's brains are sucked out, causing the skull to collapse. The dead baby is then removed.
So that was a video of the partial birth abortion, which can happen during your later pregnancy in your 2nd or 3rd trimester. And abortion became legal because of the Roe versus Wade Supreme Court case in 1973, and it just made it to where abortion is legal up to your 12th week of your pregnancy. And there are special cases on whether or not abortion can be legal during your 2nd and 3rd trimester if it will affect the health of the mother. And for fetal development in your 1st month, your heart begins to develop along with your digestive system, and your backbone and spinal cord begin to form. And in month 2, your heart's functioning, and you get your eyes, nose, lips, and your facial features. And in your month 3, you get your recognizable forms, which are your arms, fingers, legs, toes, your feet. And during your 4th month, you develop your reflexes, which is like sucking and swallowing. And by that time, you can weigh up to 6 to 7 ounces. In month 5, your hair begins to grow, and you get lingo, which covers your whole body, which can last up to a couple months after birth as well. 6 months, your eyelids begin to form and the baby is able to hiccup and you can feel it. And by 7 months, they are considered premature babies and they can last outside the mother's uterus. And they are 2.5 to 3 pounds. And in the 8th month is where you get your rapid growth of a baby, and that's where all the organs are formed except for the lungs, which form in the 9th month. And the 9th month is when the baby can survive on its own outside the mother. And you have other options besides abortion, which can include adoption and then your multiple different kinds of birth control, which can be the pill, condoms, IUD, the cervical cap, vaginal ring, or spermicides. So why we shouldn't abort. A baby at 12 weeks has most of its organs formed. Your arms, fingers, and legs are also formed. And a baby has a heartbeat that can be heard through ultrasound. And it's a human life inside of you that is growing. And they are innocent. So if it's not okay to kill a baby after birth, why is it okay to kill a baby during? Thank you for listening to my speech.